Okay, so this is your labral repair preoperative frequently asked questions video. We love putting these videos together for our patients because they answer like 99% of the questions people have about this operation. So hopefully after watching this video, the majority of your questions will be answered and you'll feel much more comfortable understanding our surgical process, which is unique to other surgeons' processes in multiple ways. So just kind of giving a highlight of this operation. We do a ton of these. Close to 150 a year, which even surgeons that are, sports medicine or shoulder specialists, it's not that common of a procedure for a lot of surgeons in their practice. We do like 100, like I said, 150. The average surgeon that does labral repairs is maybe doing like 15 a year. It's not a super common surgery. So our volume is like 10 times higher than the majority of surgeons who are doing this operation. That just makes us, we understand the surgery better. We understand, how to deal with complexities, et cetera. Everything is just much more efficient. We have more experience with this. This is a surgery I understand very well because I've had 2 of them on my own shoulder, right? So this is one where I've done a lot of them, but I also have had it on my body. So I know exactly what it feels like to go through this surgery. So, and it's a great operation. We're typically doing this in our younger patients. So they're very active. And we're giving them back a huge thing that they've lost in their life, which is typically like something cool that they want to do or work out. It's day-to-day stuff too, but we love doing it because it's a fun surgery and our outcomes are fantastic for this, like 99% success rate for majority of our patients doing labral repairs. So it's an awesome operation. We're excited that you're here and watching this video because this is the first step towards getting your shoulder fixed. So, all right. So a couple things. What can you do beforehand? Watch this video. That's a big one. Make sure you're eating plenty of protein in your diet. For men and women, about 0.75 grams per pound. So that'll just help with healing before and after surgery. So make sure you're getting plenty of protein in your diet. Exercise before and after with your shoulder. Just try to avoid exercise as much as you can without things that avoid things that are causing pain in the shoulder. But otherwise, just coming to the operation just kind of physiologically optimized, you're just going to heal faster, you'll bounce back quicker. Set up your therapy. So try to get this set up beforehand and we'll help you do that. Decide on your follow-up. Do you want to do telemedicine or do you want to come back in person post-operatively so we can set that up beforehand? It's whichever one you want to do, whichever you feel more comfortable with and whatever is more convenient. Make sure you get your PROM forms filled out. So it's going to be sent by something called CareSense. Preoperatively, I want to make sure we'll send that to you, fill it out. It's very important for us to capture and track our data. And then get all your pain meds done, right? So you'll have a pre-op appointment in some regard, and they'll give you all your medications and go through everything. Make sure that you get all these filled before surgery. That way you don't have to worry about it after surgery. You don't want to be sitting there post-surgically that day with, trying to figure out, the pharmacy ran out of something or so. This stuff happens. It's weird, but it does. Just deal with that beforehand. That way you have your medicine and right after the surgery, you can just take a deep breath and chill knowing everything's taken care of. So that leads us to the first thing, pain meds, pain control. So I recommend, just doing for this procedure, ibuprofen, Tylenol baseline. So 4 ibuprofen, 2 Tylenol, 4 ibuprofen plus 2 Tylenol 3 times a day. Just do that for like the first 1 to 2 weeks. And then we're going to give you some tramadol, which is a lighter pain medicine, then oxycodone, which is the strong stuff. I recommend ice your shoulder down 3 to 4 times a day, 15 to 20 minutes, especially before you go to bed so you can sleep. We do give you CBD. More than happy to have you try this. It's medical grade. It's just one more thing to knock down your pain without taking the strong narcotics. And also we're going to give you some meditations, some links to some videos on YouTube for pain meditations. It'll help you a lot with kind of dealing with post-surgical pain and dealing with the mental aspect of getting your mind in the right spot. So you can it just brings everything down another notch. It's just another way to treat your pain. And this stuff is effective. It really is. And there's tons of evidence and science behind it. So we'll make sure we send you those links. Watch your diet, your anti-inflammatory diet, look that up. Just Google anti-inflammatory diet. But in general, it's just higher protein, healthy fats, lower sugars, lower processed foods. Watch your alcohol intake. You're going to get a nerve block. Typically, people choose to have a nerve block before the surgery. If you want to have it, great. If not, it's fine. Most people choose to have that. So you'll be numb for about 24 to 36 hours. So that first night, you'll probably be numb. Let's say you have the surgery on a Tuesday. Tuesday night, you'll be numb. Wednesday night, you may wake up and feel a little bit of discomfort. in the middle of the night. So take one of the strong pain pills that second night. And then after that, you can kind of dial it in. If you never take any of the strong pain medicine, awesome. I love that. Like if you could, you know what I mean? Like if you need to take it, take it. So it's as much or as little as you want. All right, so the sling. So this is a big one, especially for labral repairs. If you don't ever wear that sling, I don't care, right? You know, we're going inside your shoulder joint to reattach a torn labrum. Moving your shoulder like this, you know, in gentle planes, it causes minimal stress across that repair. And the repairs we do are crazy strong now. And we use these tiny little anchors that are very strong. So you're not going to rip them out. It takes a tremendous amount of force to pull those out. You just don't want aggressive stretching that causes pain, and you don't want aggressive lifting early on. But for the sling, 100% for comfort. For labral repairs, people are wearing them for a couple of days, and then after that, they're out of them, right? Now, if you want to wear it. You do not need to wear that sling at all, though, especially for a labral repair. It's minimal stress across the joint. It's perfectly safe. We've done this for years. There's no data suggesting that, you know, wearing a sling for labral repairs really does anything at all. So just wear it as little or as much as you want. For weight restrictions, again, activity after labral repairs, it's simple. You can move your arm as much as you want. I don't want aggressive stretching out like here, out here, or like really aggressive behind the back or really aggressive across. That stresses the repair, but you will feel that. Like this is more for the therapist to not push you. If you just listen to your body and don't do things that hurt, you're never gonna tear or rip the repair. In terms of lifting, try to keep it less than 10 pounds with your arm fully extended, right? In here, you can pretty much let pain be your guide, knowing that you're never gonna damage anything if you're down in here, regardless of how much you lift. Now, that being said, I don't want you to push it and go like be lifting heavy weights in that first 3 months. Like let your body heal, take it easy. I'm talking about just daily stuff. Still try to avoid heavy lifting, heavy use, things that cause pain. But in general, if you keep it less than 10 pounds out here, don't do aggressive stretching. You're never going to do anything to compromise the surgery. And again, don't do things that cause pain. You'll never do anything to compromise the surgery. You know, you can go to the bathroom right afterwards for a bra. We have all of our videos show women to do this. But again, you're going to flip your bra around backwards, buckle it, flip it around so it's the right way. So the bra part's in front, one arm down here, and then slide it up. No permanent restrictions after this surgery. You can do whatever you want. Next thing is sleep. So just find out a comfortable position to sleep in. You know, whatever's comfortable, that's the way you should sleep. And for most of our patients, I recommend being in your own bed with 1 or 2 pillows up behind your back. So you're kind of like this, and then like some pillows underneath your arm here, like 1 or 2. With or without the sling, totally your call. Don't need to sleep in a recliner unless you want to sleep in a recliner, but you can sleep on your operative shoulder. You can sleep on the opposite shoulder. You can sleep on your back, sleep on your stomach. You can sleep upside down. It doesn't matter to me, like whatever position is comfortable, that's the way that you should sleep. All right, therapy. So I do think therapy is important for this operation to get everything back on track. I want you to see a therapist because most of our patients that are getting this operation are younger and more active, and I really think the therapist has a lot of value for you. You can do traditional in-person, where you're going in person and you're just doing the exercises there. If you're going to our therapist, like TOA's therapist, I'm perfectly fine with just doing all that in person because I know those therapists, I trust them, they're my therapists. Okay, incision care, very simple procedure. With incisions, there's typically 3 little poke holes around the shoulder, 1 little stitch. You can shower the day of surgery. It's a waterproof dressing. Take that off. So let's say you have surgery on Tuesday, take that off on Wednesday. You can shower, let water run over the portals. Just don't soak any pool or tubs for the first week or 2. And then after 10 to 12 days, we take out the little poke hole sutures, and you can do that from home, right? Like we can show you how to do that easily from home. And that's it, put Band-Aids over the poke holes too. And then after that first day, and then shower, and then change out the Band-Aids. Okay, bruising and swelling. So this is perfectly normal after surgery. So expect it. Expect that your arm's gonna be swollen, expect that you're gonna have bruising. It's different with everybody, certain extents, more or less with others. It'll go away after like 3 to 6 weeks typically, and it starts to show up typically around like 3 to 5 days after surgery. So don't be concerned if it happens, expect it, and that way you won't worry. You're gonna get some swelling down your arm and in your hand, all that's normal, it will go away over time. You may feel a little bit of tingling in your fingers just from the swelling from the surgery, that's normal. And if you have that, don't get overly concerned. it'll go away with time. It'll go away with time. You're going to get some clicking and popping in that shoulder. A lot of this is fluid and then also scar tissue from the surgery. It will go away with time. We don't get concerned about it unless it's very painful, okay? It may take 6 months to a year for all that clicking to go away, but try not to get too focused on it. Only get concerned if it causes pain. But just kind of know that you may get some clicking after surgery. Here's your lesson, or this is me telling you ahead of time, don't get concerned. That's just scar tissue and sometimes a little fluid from the operation that's going to settle down. What's my recovery time after this surgery? Again, all activities of daily living are perfectly safe afterwards. Labral repairs aren't a terribly painful surgery. Rotator cuff repairs tend to hurt a little bit more just because of how we're anchoring things in. The anchors we use for this surgery are tiny. They're little all suture anchors. They work really, really well. So, you shouldn't have that much pain after this surgery. I'm speaking from experience. It's just kind of annoying for that first week or two. But for the first 3 months, you just want to take it easy. No aggressive stretching. All activities of daily living are fine. Keep the lifting less than 10 pounds with your arm extended. After 3 months, you can pretty much do what you want. Just go slow, right? Like you just kind of slowly ramp up into your activities where if you're an athlete, we want full aggressive contact, typically around like 6 months is what we recommend, because that's how long it takes to get the strength back. PROM, so these are patient reported outcome scores. Super important you fill this out pre-op and post-op so we can track your data. We need this data in order to continue to evolve and get better. Driving, the second you're comfortable driving, you can drive as long as you're not taking the strong pain meds. Work and travel, get back to work as soon as you're ready, right? You can go back to work the week of surgery if you really want. I typically tell people just take it easy, like take that week off. It's easier on your body and your mind just to let yourself rest for that first week or two, or really for the first week, and then go back to work the next week. Like if you have surgery on a Tuesday or Wednesday, take off Thursday, Friday, go back Monday. You'll be fine. How long does surgery take? We do a ton of these, so we're efficient, right? So this surgery typically takes less than 30 minutes for us. So pretty quick operation. Minimize how much time you're on the table. Minimize your anesthesia, which decreases, nausea, complications from issues from anesthesia. Also decreases pain post-op, just not having you, stressing your body as much. This is an outpatient surgery, so you come in, go home same day. You'll be at the center for several hours. Just plan to be there about 2 to 3 hours before the surgery, and then for an hour or two afterwards, just for the check-in process. And then exercise. This is a younger person type surgery. Highly recommend you exercise before and after the surgery. Just follow the restrictions on your shoulder. Don't overdo it. But let's say you're having surgery on your left shoulder here. I actually want you to still work your right arm, right shoulder. And people are kind of worried about this asymmetry they're going to develop. Actually, what we have found is that the stronger this stays, the quicker this bounces back, because your body wants symmetry. Also, you can work your legs like crazy too. Go on walks, ride the Peloton, keep your endorphins flowing. You'll have less pain, you'll recover faster. So that's your labral repair video. Super excited to get you fixed. And hopefully this covered 99% of the questions you have.